Are you feeling stuck trying to conceive? Are you wondering what actually works to boost fertility the fastest? I'm going to give you the top 3 ways that I help my clients and patients to boost fertility naturally. I use these in my clinic, and this is how we get started. Or if you need a refresh. First, we have to start with food. Fertility starts in the gut, and fertility starts in the kitchen. There's no way to get around this. And some people try to, but eventually you're going to come back to the kitchen and to your food. We want to focus on antioxidants. Think blueberries, strawberries, blackberries, raspberries, all the berries, and really try to use organic food. If not, you have to clean and wash to get the toxins off and the pesticides off. You also want to focus on leafy greens like kale. Collards are amazing. Spinach, anything green and rich in color. We want to add in turmeric and ginger, and there's other spices and seasonings that also benefit fertility health. Next, we want to focus on omega-3s. So wild-caught salmon, we got to be really careful about where the fish are coming from because of the mercury content. Also, you can add in walnuts, chia seeds, flax seeds, you name it. And by the way, if you need help with finding omega-3s, sometimes we get to a blank, just drop a comment below because I have a whole sheet, I think of 20 or so. I'm happy to send that list to you. We also want to focus on hydration. I usually tell people you want to drink at least half of your body weight in water in ounces. For example, if you weigh 150 pounds, you would want to drink 75 ounces of water a day. And then again, that depends on where you live, how much exercise you get, your climate you're in. And I'm in a really dry climate, so I definitely have to drink a lot more water here than I do when I'm at sea level. I'm at 10,000 feet. If I'm at sea level and it's really humid, that's going to impact me a little bit differently. So these are more than just nutrition trends. These are the essentials that your body needs to support egg quality, fertility health. By eating all these healthy foods, they're going to balance your hormones naturally. I have really extensive videos on food. I do want to point out that if you have digestive issues that you do want to focus on, sauteed or steamed foods and vegetables, soups and stews. If you need more help with that, feel free to go to my channel and look through. I've got a whole fertility food playlist. Or comment below and I can navigate you to the proper videos. Next up, the second tip is gentle movement. Just 30 minutes daily. I know people say just a few times a week, but there's so much stress that gets caught up in our system. So every day you want to get movement, and we're not talking HIIT and running and high impact. I'm talking about walking, yoga, swimming, hiking. All of these exercises can reduce inflammation and stress. But it's not just physical. Movement also helps to regulate your nervous system. It'll improve your sleep, which is vital for hormonal harmony and ovulation. If you're just discovering my channel, welcome. Hello, I'm Dr. Gina Terinoni. I'm a board-certified doctor in acupuncture and Chinese medicine. I'm also certified women's healthcare practitioner in integrative medicine. So I blend 2,000-year-old healing practices with modern science. I try to stay up on all of the studies that come out. Over the last 25 years, I've helped over 2,000 women and couples to get pregnant. And these women were all over 30, 35, and they've had healthy babies. I would love to help you too. Please hit the subscribe button because I release videos every week. And all of my videos have at least one strong, simple step to take to help you to move closer to conception. The third tip today is you have to know your ovulation window. I know a lot of women guess or assume that it's based on a 28-day cycle, and there's research that shows that it's 12 or 13% of women that have a 28-day cycle. And of those women that have a 28-day cycle, maybe 13% ovulate the same time right in the middle. It can vary, it can fluctuate. We want to track ovulation and menstrual symptoms. Ovulation is your power window. If you're not tracking it, you're guessing, you could be totally ready to get pregnant, but you're missing. So you can use ovulation predictor kits. They're not always effective. I also recommend you track with a BBT charts. You look at cervical mucus. Again, I have really extensive videos on how to chart ovulation. Comment below if you need help with that. I'm happy to drop you a link to that direct video. You want to aim for intimacy every other day in the 5 days before you ovulate. So that's when you know. And if you're like, I don't care, I don't want to track, then you need to have intimacy every other day for 14 days or throughout your entire cycle. Like, more power to you. And support your partner's fertility too, because he's under stress. Maybe his sleep isn't great. And nutrition for men is huge. This is a nice thing to do as a couple. And it'll help to improve egg quality, and it'll also help to improve sperm health. Nutrition is powerful. I've got videos on supplements. I've got very strong herbal formulations that I put together for men and women. I want to know, this is the question of the day. How are you currently tracking ovulation? Or if you're not, what's confusing about it? How can I help you to clear that up? I would love to see your comments below, and I will personally respond to them. If today's tips gave you some clarity, it's got you thinking and you want more, please be sure to subscribe to my channel, hit the bell, because next week I'm sharing supplements that I use in my practice to help improve egg quality, especially for women over 35. Thank you.